Membership data comes from the eligibility or membership database maintained by each payer. This database identifies those individuals who are eligible to have their medical claims paid by the payer. There are some standard data items that all payers will maintain, but there are a lot of unique items that each one has in the database, and we won't be talking about many of them. We'll talk about a few that are getting more typical. But when you work with a payer, you'll have to understand what's in their membership data, and it may be very different from one payer to the next. The first category of data is data about the group that the member belongs to. There'll be a group ID, which will be a unique code assigned by that payer to the group under which the individual is covered. That could be an employer, it could be a union, it could be any of the other groups we talked about in a previous session. Then there'll be a subgroup ID, or there'll be a set of subgroup IDs. These are relevant subsets of the group that might be important for coverage or reporting. It could be a division or a branch of an employer. It could be the region of the country that that member lives in. It could be a bargaining unit if you're talking about union coverage. There'll be other group taxonomy data items, and these will be different from payer to payer. But these are relevant pieces of information used for categorizing a group, usually for benchmarking. It could be, for example, the industry that an employer belongs to. Say it's a trucking company, then you might want to compare their costs or their benefits to other trucking companies. Employee size is another area. Is this a small group, say under 1,000 employees? Is it a medium group, say 1 to 5,000? Is a large group over 5,000? Once again, this is largely done for benchmarking and often for premium setting, but that would have done before you're building a membership file. And there's nothing magic about small, medium, large being 1,000 or 1 to 5 or over 5. Those are just categories that some organizations will use. The membership data will include identification of the contract holder or the insured individual. This is the person who actually holds the contract for the coverage. If this is an employer group, then it will be the employee who is identified. There will also be, if it is an employer group, an indicator of the employee's status. This will be the relationship between the employer and the insured. It'll indicate if the person is an active employee or they're a retired employee. There might be a separate category for early retiree, which would mean pre-Medicare. There'll be information about whether the person is full-time employee or part-time. That's more and more important under the Affordable Care Act. And there'll be other categories. I worked with one client who had a separate category for the spouse of a fallen firefighter or police officer because they got special insurance coverage. In addition to identifying the contract holder, the membership file will include identification information about the member. This, once again, is a unique code assigned by the payer to each covered individual. This might be the insured or it might be a dependent. Generally, you will also see the member's Social Security number. Even if the member ID is not the Social Security number, and in this day and age it really should not be, the Social Security number is needed for linking to other data sources. For example, if you need to check coordination of benefits with another insurance carrier, you will need some common number to identify a person, and Social Security number is that number. If you want to bring in information from other, say you have wellness programs that you want to identify this member with, you need to have some way to talk about the same members to those subcontractors. So a member Social Security number will generally be in a membership file. There will also be miscellaneous flags in there about the member. It could be related to their health status. It could be a member related to their participation in certain wellness programs. And it may be involved in underwriting. For example, smoking status is often involved in determining premiums or a premium surcharge. These could be for reporting purposes and other analytics. Smoking status is one, marital status is another category, alcohol consumption, We've all answered questions like this for various purposes, such as do you never drink? Do you drink socially, say 2 or 3 times a week? Do you drink 5 drinks a day? That will be often recorded in the membership file. The membership file will also contain demographics about the member. It will include the member's date of birth. It'll include the member's sex, and this should really be the biological sex of a member as opposed to gender preference. If claims come in for, say, uterine cancer or prostate cancer, it's the biological sex of the person that would be checked, not just their gender preference. The member's relationship to the insured would be in there, so how the covered individual is related to the contract holder. You'll have values for self, spouse, child. I've seen lists up to 20 different values, with including different types of domestic partnerships, including parents, separating out natural children from adopted children, sons from daughters. There'll be lots of different categories, but the 3 basic categories will be self, spouse, and child. And you'll have the member zip code, so the postal code of where that individual lives. That's one of the very important fields for analytics done by payers. Information about the coverage a member has will also be on the membership file. There will be a coverage start date, which indicates when that member's health care is eligible to be covered by this insurance plan. There may be a termination date, a coverage end date. If a person leaves an employer, for example, there would be a termination date. There also could be a change in coverage, in which case there'd be a termination date for one type of coverage, and then there'd be a new start date on a new record for a different type of coverage. There will be a plan code which identifies that type of coverage that a member has. This will be a code that links to a benefits file that will detail the actual benefits that they're eligible for. Are they limited to 30 chiropractic visits a year? Do they have a 20% copay with 0% copay on preventive benefits, preventive services? All that will be detailed in the benefits file, and there'll be a plan code, or there could be a series of plan codes that links that member to that plan file, to the benefits file. Very often membership files will be organized by month. So for every member, for every month that they're covered, there will be a separate record. So you may just have the coverage is January 1st, and coverage start January 1st, coverage end January 31st, and here's a plan code for that time period. You may have another record that starts February 1st, goes through February 28th, another record for March, April, etc., etc. Each payer is a little different, so you need to know how that payer's membership files are organized so that you know how to process it, or you know how to request data from each payer.